Namaskar viewers, hello and welcome to Sansad TV. I'm Tina Jha, you're watching Perspective. On the program today, we will talk about Har Ghar Dastak campaign, the second leg of which commenced on Wednesday across the country to ensure complete COVID-19 vaccination of all eligible beneficiaries. The 2-month-long door-to-door campaign will run from 1st of June to 31st of July. The first Har Ghar Dastak campaign was conducted in November last year. So far, more than 193 crore doses have been administered across the country. So we'll try and understand on the program today, what does the Har Ghar Dastak campaign aim to do? What is it focusing on? Also, what is the progress we've made so far in the vaccination drive against COVID-19? So some of these aspects and much more on the program we'll be discussing with an eminent panel of experts who are joining us virtually. I'm pleased to welcome on this edition of Perspective, Ms. Preeti Sudan. She's former Health Secretary, Government of India. Dr. N.K. Arora, Chairman, National Technical Advisory Group on Immunization, and Dr. Raman Gangakhedkar, Dr. C.G. Pandit, National Chair, ICMR. Thank you to all my guests for joining me on the program today. Welcome to Sansad TV. Dr. Arora, allow me to begin the program today with you. Let's first try and understand what is the objective of the Har Ghar Dastak Campaign 2.0.
And this is a very a kind of a next milestone of our war against this pandemic. During last 6 to 8 weeks, we have seen that there has been a kind of a downtrend in doses dispensed every day. There was time that we were administering 70 to 90 lakh doses per day. And during last 2 months or so, it has come down to anywhere between 8 lakhs to 12 lakhs. Mm-hmm. And so that is an issue of concern. And probably there are very obvious reasons. One is all of us have noticed that from first week of March, the number of COVID cases have come down, and there was a time that it was less than 1,000. Today also it is anywhere between 2 to 3,000 cases every day. The second is there are severity of cases are not seen. It is uncommon, and usually it is in those individuals who are already admitted and have other serious comorbidities. And third is, fortunately, deaths are also extremely uncommon. So I think there is a certain degree of complacency in our community, and people are not coming for either the protection dose or the regular primary doses for children also. Both in 12 to 14 and 15 to 18. And there is another issue which has come up, that particularly those who are elderly, those who are not able, those who are sick and who are not able to come to the immunization sectors, and then children also, they may be away to the school, and so that there is a reach out program. So just like Har Ghar Dastak Part 1, now we have Part 2, and to reach out both in rural and urban areas. And last time also it yielded very good results. We were able to reach particularly the elderly, the sick and infirm individuals. And then there are those issues with disabled individuals who have various kind of difficulties. So the target is that these are the all high risk individuals, and we must reach them at their home. And primary learning is from polio. Madam Preeti Sudan is there. She has been a key driver where house to house polio vaccination program helped us to achieve 100% almost. Absolutely. And the same strategy we have learned, and probably globally we are among probably the only country which has started this Har Ghar Dastak program based on our learning on polio program.
Okay, so let me go across straight to Ma'am Sudan and understand what lessons have been learned from our door-to-door campaigns earlier with other public health programs as well. And now also in the month of November last year, we had launched Part 1 of the Har Ghar Dastak campaign. Ma'am, help us and our viewers understand first what necessitated this second leg of the campaign when it was so successful in the first leg. Do you agree that there's this sense of complacency that has creeped in among the community? And also, what is the roadmap going forth of this second leg of the campaign in terms of coverage and the focus population?
So thanks, Tina. If we see our vaccination campaign, you see it has been very responsive to whatever situation has been evolving. We started our vaccination on 16th of January 2021. So 1 year, 4 months plus into vaccine. And you have seen that we have organized workplace vaccination centers, near to home vaccination centers, mobile vaccination teams. So this Har Ghar Dastak campaign was a natural corollary, I would say, to our earlier initiatives to reach out to people who need vaccination, who are willing to take vaccination. And I would say that we have learned from two important programs. Dr. Arora mentioned our polio campaign, very successful. We are polio free, thankfully, now since many years. Then we have had Mission Indradhanush program. We've had Gram Swaraj Abhiyan program, where we have taken up vaccination of the dropouts, vaccination of people who've been left out, or vaccination of eligible population who could not be reached earlier. So you see, this is Har Ghar Dastak is a focused vaccination program to reach out those who have been left out. And reasons for being left out can be many. You see, it could be, as Dr. Arora also mentioned, and you have also pointed out, Tina, it could be complacency, because you see now we don't see many severe cases, or we don't see deaths. We are, so it's very natural for us humans to become complacent, number one. Number two, you see the old aged, the differently abled, and even I would add vaccine hesitant populations. Though I must say that India is a global example of how, setting context in a diverse population of our country, we've had barely, I would say, very little vaccine hesitancy. So this campaign is a focused campaign to reach out these categories. And also one thing I'd like to add, it's very interesting and it's very timely because children are now at home. You see these summer vacations. So the 12 plus children can be reached out at home now, the school going children. Thank you.
Okay. So I'll come back to you and understand, what really has brought before us. We are back again in a situation, Dr. Gangakhedkar. Each time we begin to think that perhaps we'll become COVID-free in this particular year, we have become, through sustained efforts, consistent efforts of the government, we've managed to become polio-free. But every time we hope to become COVID-free, we have this scare of, cases rising. And once again in Maharashtra, particularly in Mumbai, there is a sudden explosion. So I think across India also more than 3,000 cases have been reported in just the last 24 hours. How serious is the situation? Are we actually staring at a potential fourth wave of the COVID pandemic?
I would put in few additional thoughts for the same. The first thing which we have to realize is, not everybody was infected by Omicron. You would have perhaps about 10% population which was not infected by Omicron because they continued to follow COVID appropriate behavior well. They stayed at home. And most often, when you look at such people, those are those who belong to older age groups or those who are children who have not been severely exposed to Omicron per se. Now, when you lift the restrictions, you find now they are getting emboldened to actually go out and take that particular risk because they are seeing everybody is walking around without mask. All the youngsters are moving out, they are going for earning money. And the impact of the same that you are seeing is there is an increase of number of cases, and that mainly happens because Omicron will hunt for those who have not been infected so far. Because we know vaccines do not prevent the new infections as efficiently as they prevent hospitalization and death. And therefore, these increases will perhaps be seen. It will all depend on who is moving at what particular point of time and how many vulnerable people are around. But should that lead to a scare? To my mind, there is no reason to panic. even if BA.4 or BA.5 comes, they belong to the same sublineage. So it is unlikely that it would perhaps lead to a similar catastrophic kind of rise that we see. There will be a small increase that you will see. People may get BA.4 or 5 because they did not have Omicron BA.2 that occurred at that juncture. But people have to realize one thing. What are we aiming at? By providing vaccines, you ensure that they don't get hospitalized, they don't die due to this particular infection. And that's so easy to do. If we can do that, you will be safer. I think it is time that we promote in our communication, your life is in your own hands. What you need is ensure that you take the second dose if you have missed one. Those who have not taken any dose must go and take those particular dosages. And the third is for 60 plus population, you need boosters. Now, unless we take that, we will not be able to protect ourselves really well. So that message has to go. Unfortunately, we have to embark on a journey where we go for house to house kind of approach. Instead, people could have gone all by themselves because it is finally their life, the life of an individual.
Absolutely. That's exactly what's concerning Dr. Gangakhedkar. And let me take that point across to Dr. N.K. Arora. Dr. Arora, each time the cases rise in the country, we of course see people themselves queuing up outside vaccination centers, something which is not the case anymore. We've seen, and that's why we've seen a dip, a lackluster response in our COVID vaccination drive. When we talk about the roadmap and ensuring coverage for all eligible beneficiaries, what's important also is to cover those not just who are vulnerable, but also who do not have access to these resources. For example, those who are imprisoned, they are in jails, and all of us are well aware of how overcrowded the Indian prisons are. They are potential clusters of COVID spread each time the cases rise. So particularly for these people who are imprisoned in jails, do we have a micro plan?
Yes, you're absolutely right. In fact, the states have also been kind of guided that COVID is very much here. And as we just heard, in last 2-3 weeks, we have got 2 or 3 more sublineages, B4, B5. And then small outbreaks are occurring in different parts of the country, small outbreaks. But certainly that just goes on to indicate. And the vulnerable population, so it is not only the prisoners, but also old age homes. Similarly, schools and institutions which look after differently abled children or even adults. And so all the vulnerable groups have been earmarked, and the states would be approaching them and providing them immunization at their own place. The second issue is that there are still, and through you, I would like to communicate that there are several women, young women, who are pregnant or who plan to become pregnant over next few months or a year or so. Many of them are not immunized. In fact, when we look at it, there is a large number of this cohort. We have around 2.5 or 2.6 crore deliveries per year, about 3 crores pregnant women. So there are, and we see those 3% which are completely left out, and there are also 10-12% who haven't received second dose. And that also, I think, should take the benefit of this Har Ghar Dastak program, because they are vulnerable. During pregnancy, if somebody gets, unfortunately, COVID infection, the risk is high, both for the mother and the fetus and the newborn. So therefore, the target will be all vulnerable groups. The another issue which has been done is that high-risk areas have been earmarked again. From every 2 or 3 years, we have been looking at, for example, the bricklayer people or the construction site individuals who don't get vaccination. So there are about 400,000 such high-risk population spots which are vulnerable, who may not have received the vaccine, and they are also to be contacted through this program.
Coming to you, Preeti ma'am, so, a very important aspect raised by Dr. Arora was the high-risk areas. And what we are seeing is, although our vaccination drive so far has been on a full swing and quite successful, but it's not always been a smooth sail across the country. So, for example, there have been geographical disparities. Also, the weather pattern in different parts of the country, they have posed significant challenges for our vaccination workers, for our health workers who are trying to, immunize the entire population. So keeping in mind the challenges that we have witnessed over the last few months in terms of our vaccination drive, to ensure that these challenges are overcome, what are the special efforts that we are undertaking so that these challenges are overcome by those who are actually working on the ground to inoculate the eligible beneficiaries?
So, Tina, as I mentioned earlier, 2 campaigns, Mission Indradhanush and then also Gram Swaraj Abhiyan. The latter, the Gram Swaraj Abhiyan, was villages selected which were most backward, most difficult areas. And similarly, Mission Indradhanush was for the population which had not been touched so far, where there were challenges of normal, routine immunization. So when we plan for such drives as this 2-month program of Har Ghar Dastak, where we are, sort of touching every house, we are touching, institutions like madrasas, daycare schools, then, Sudhar Grahs, and, as Dr. Arora also mentioned, jails. So when we are doing the vaccination for these areas, very minute planning is required. You see, you need the carriers for the cold chain carrier for the vaccine. You need a person or our ANM or our ASHA, our health worker, who knows that area, who inspires confidence of the community. You need community support of the elected, say the sarpanches, the punches. You need support of the self-help groups. So you see, the campaign involves many people. And, even as I'm saying, and I have always, in my 3 years of as health secretary, always wondered and marveled at the dedication of our health workers and everybody who's involved in vaccination. Otherwise, it wouldn't have been possible in a country like India. As you also said, already doomsday was declared for us by international media and international agencies. But we showed that, in times of crisis, we are all together. And leadership at the highest level, with Honorable Prime Minister monitoring himself, we've shown that we can do it. So I would say that it's a lot of planning involved, but then a lot of experience also is guiding us. And I'm sure this campaign will be a huge success.
Absolutely. But till the time, the virus exists amongst us, the threat of new variants will always be there, Dr. Gangakhedkar. And we have to ensure that vaccination process becomes smoother, simpler, and more effective for all age groups. So in terms of expanding our vaccine basket and also covering those who are still not covered, so meaning those who are under 6 years of age, even they are stepping out of their houses, or even if they are not, they are under potential threat because of the elders stepping out. What are the steps that India is particularly undertaking to cover its entire population?
I wouldn't say talk about entire population, because we really do not know whether we will have to immunize each and every person who lives in India. But at the same time, I would say we know the most vulnerable groups. Even if we manage to protect all of them, perhaps we would make a huge difference. And one thing which I must say, though we tend to say, talk about, if we compare with other countries which are developed countries, our vaccination rates are far better than those countries as well. Now the question is, we have to mobilize the community to ensure and protect the most vulnerable populations. Now, the younger ones with whom perhaps we are worried about may have had acquired this infection during the Omicron wave, when the adults in the family had also acquired it. So, and they tend to handle this particular infection really well. Their immunological support that they have within their body continues to remain robust and strong enough. But at least among them, those who are now targeted group is around 12 to 14 years age group, that is approaching more towards adolescence. So there is a worry. You would like to protect them. So both these groups, 60 plus and 12 to 14 years age group, they must, they must try to take their dosages in time and ensure that they remain protected. Because one must always remember what is most protected is hospitalization and death. And you are protected mainly because you are already immunized. When the new variant, if at all, if it is going to come, comes in my body will be able to fight with that particular infection. So essentially, it's up to us. These are our own lives. We have to take it. And if the government is coming for coming to houses, we must at least ensure that we go and take that vaccine, whatever was missing at that juncture.
Okay, one final comment from Dr. Arora. We've spoken about the Har Ghar Dastak campaign, and our vaccination drive so far has been, very, very effective. So we hope to ensure that this pace of vaccination, which has suddenly begun to see lackluster response, will no longer be the same, and this campaign will be successful. But in terms of learning lessons from the pandemic, we've been through the pandemic. This is the third year. What are the valuable lessons that we have learned, not just in dealing with the pandemic or future such health crises, but also for our various public health programs?
So there are 3 or 4 very important lessons. In fact, Professor Gangakhedkar is there. Right from the beginning, there have been talks about herd immunity and endemicity. Both are mystical and mythical, because the virus keeps on changing, and every time, every new wave has been driven by a new virus. So this whole concept of herd immunity and endemicity does not stand anywhere. And all of us need to understand that the virus, till it is there causing hospitalization and death, whatever the variant is, we need to be careful. And that's a very important lesson. So there is no scope for complacency either from the system side or from the community side. And Har Ghar Dastak is a great movement we learned from last time, is a very positive way of community engagement. When I go somebody's house and somebody very near and dear whom I know, either is Asha or A&M, it generated a lot of confidence last time, and I'm sure this time. The second is the parents of some of the children of 12 to 14 or 12 to 18 years still need more confidence and trust that this is a safe vaccine and necessary vaccine for them. And so this is also is a strategy to bring them on board and accept the vaccine. And finally, the third thing is that we need to continuously kind of engage all sections of society at all times, so that everybody is participating, and it should continue to remain as people's movement. Our health workers, health personnel at various levels, and the community. This is, I think, the underpinning of our success also, I very strongly feel. And that we need to continue. And this Har Ghar Dastak is a very important step towards that.
Absolutely. So, I mean, for any abhiyan, for any campaign to be successful, it's very, very important for people to be part of that movement, and only then it can yield the positive results. So, that having been said, I'll have to wrap up the discussion. Thank you once again, Dr. Gangakhedkar, Dr. Arora, and Preeti ma'am for joining us on the program today, sharing your thoughts with us and our viewers. Always a pleasure to have you on the program with us. So that's it from us on this edition of Perspective today. Thank you very much to all my viewers as well for your time. Take good care of yourselves. Maintain COVID-appropriate behavior. As our panelists have suggested, the cases are once again rising. So we all need to go back to the basics. Be masked up whenever you step out of your houses. Take care of yourselves, your families, and also keep watching Sansad TV. See you again same time tomorrow.